as a patient, that's the main people I'm making this video for, that you understand these are your rights, and that if at any time you're seeing a practitioner, no matter what kind of medicine they're practicing, they have to respect these things. So these are things where you could say to the practitioner, no, I don't want to have this treatment, because that autonomy trumps all of that. They can't force you or coerce you into having a treatment that you don't want to have. And look, we're entering into a time where people, are feeling pressured to make particular decisions by society, let's just put it like that, about their healthcare. And really, it's up to you as an individual. You can get the information and you should be empowered to make your own decisions. Beneficience. Out of all of the things that we could do for you, is this the most beneficial thing? Autonomy. Therefore, the decision-making process should be free of coercion or coaxing. The reason why I'm making this video is to make it very clear that sometimes you have to stand up for yourself and say, hey, I don't understand. And it's the practitioner's job to explain that to you. So they can't administer any kind of treatment on you unless you give them consent for that. What are the basic medical ethical principles that your practitioner should be abiding by? No matter if they're a Western medicine practitioner, your GP, your doctor, or your Chinese herbalist, or your acupuncturist, or your chiropractor, or any kind of medical practitioner, physiotherapist, physical therapist, they all have this in common, these 4 medical ethical principles. We're going to talk about what they are today. My name is Marie Hopkinson. I'm a Chinese herbalist and an acupuncturist in Perth, Western Australia. And I've also had many, many years of teaching and talking about these kinds of things in the classes that I teach, and helping students kind of explain and understand that, so that when you get out into the world as a practitioner, you're kind of helping people in the best way possible through practicing ethically, practicing in a kind of a code, right? So what's an ethical principle? It's kind of a moral code. It's like an agreed upon code of practice, or a moral, or a standard, let's say, that practitioners agree that this is the right way to go about practice, or that basically this is the line. We shouldn't, this should be the level of the lowest level of standard, let's say. We shouldn't dip below that level of standard of care, right, for people. So I think it's important to understand this, not just because I wanted to make another video to share with you, but because I see people easily get ramroded by practitioners. Let's say maybe some practitioners could bully people into making decisions in their healthcare, and we are becoming a society that's more and more informed. Like, people are more and more likely to watch videos. Like, even my own patients will say to me, oh, Marie, I've watched some of your videos before I came to see you. So they've investigated me. They've looked for a practitioner that they feel would help them, and that's how they've come across that practitioner, right? So that means people are researching. They're researching about their condition. They're researching about what kind of things could help them. And so it's good to be informed of this, because these are kind of like your rights. No matter where you are in the world, these are universally agreed upon, like your rights as a patient. And also, if you're a student watching this, it's important to understand, well, this is why we have these things in place to help patients make the best decisions for their healthcare, and to provide the best kind of practice by respecting the patient's decisions and things like that. And look, we're entering into a time where people, are feeling pressured to make particular decisions by society, let's just put it like that, about their healthcare. And really, it's up to you as an individual. You can get the information and you should be empowered to make your own decisions. And your practitioner, no matter whether they're a Western medicine practitioner, whether they're a GP, they have to respect your decision. They have to respect your autonomy. Right? This is the first principle of medical ethics, which is autonomy. Now, I'm going to read some of these from a website, which is a Stanford University website. It's a standard, it rhymes with Stanford, but it's a common website, so I just thought I would read them from there. But these are universally accepted principles. I'm not making this up. These are taught all over the world in Western medicine. They were taught to me when I was learning Chinese medicine, and I teach them to my students and those kinds of things. So what is autonomy? The dictionary definition of autonomy is the right or condition of self-government, to make your own decisions by yourself, not influenced by other people. Obviously, practitioners are going to influence you if you ask them for an opinion. If you go to a practitioner and you say, hey, this is what's wrong with me, I'd like to know what you think. But at the end of the day, a practitioner has to give you autonomy. You have to make the decisions yourself. We can't make the decision for you, right? So if I could say to my patients, you need to take all these herbs, but it's their decision whether they take them. And if they decide not to, I have to respect that decision. So the same as with Western medicine, drugs, pharmaceuticals, whatever kind of options you're offered, right? So these things shouldn't be forced upon you. These are options that practitioners can offer you. And you as a patient have the right to decide. And so how do you make the right decision? So you need to get good information from practitioners. And that's why it's good to go to a practitioner and not make that decision based off of the internet alone, based off of YouTube videos or things like that. And so yes, you should do your own research, but part of that should involve going to your practitioner and asking them what do they think, and finding a practitioner who you trust and you can ask that information. And maybe sometimes in some conditions it might mean several practitioners you might need to ask, before you're able to make a decision and feel that you've got enough information to exercise your autonomy. So in this Stanford website, it says autonomy requires that the patient has autonomy of thought, intention, and action when making decisions regarding healthcare procedures. Therefore, the decision-making process should be free of coercion or coaxing. In order for a patient to make a fully informed decision, he or she must understand all the risks and benefits of the procedure and the likelihood of success. So this is part of what's considered informed consent. So you might have heard this word bantied around a lot. Oh, you need to have informed consent, or we're giving you informed consent. Informed consent isn't giving you a piece of paper with all the information on it and hoping that you understand that and then getting you to sign, and that you say, oh, the patient signed the consent form. If they don't understand that, it's not informed consent. So it's your right as a patient. And the reason why I'm making this video is to make it very clear that sometimes you have to stand up for yourself and say, hey, I don't understand. And it's the practitioner's job to explain that to you. So they can't administer any kind of treatment on you unless you give them consent for that. So the second one is justice. So in this Stanford University site, it says, the idea that burdens and benefits of new or experimental treatments must be distributed equally among all groups in society. It requires that procedures uphold the spirit of existing laws and are fair to all players involved. The healthcare provider must consider four main areas when evaluating justice. So fair distribution of scarce resources, competing needs, rights and obligations, potential conflicts with established legislation. So then it says here as an example, reproductive technologies create ethical dilemmas because the treatment is not equally available to all people. So this is supposed to be what's practiced in medical care, but I'm sure if you're watching this video, you may have come across a situation where you felt like I didn't receive justice, or I felt like I was at the bum end of the stick when it came to my options of my treatment because it was related to my financial resource. I didn't have the ability. And so this is considering, like, especially in governmental organisations that provide healthcare, that they should be provided equally, no matter people's race or status or socioeconomic situation, that those things. And then you have also things where fair distribution of scarce resources might be where there's some kind of need for a treatment and there's not enough of that treatment to go around, like need for a medicine, and lots of people want it, so who do you give it to first? Those kinds of things. Now, this might not be something that you'd think about as a patient, but certainly your practitioner, if they were in this situation, they may have cause to think about this in how they run their business or the decisions they make. This isn't just for individual practitioners, but like, let's say if you're running a hospital or something like that. So basically the bottom line of justice is that there should be fair distribution of scarce resources, and that there should be an element of fairness in the resource distribution of medicine or of that medical treatment or those kinds of things, right? Okay, number 3 is beneficence. So it means what it says in a way, like it should be beneficial to you. And the treatments recommended by your practitioner should be of the most benefit to you in your situation. So whenever you've had, like let's say medical procedures, or even let's say acupuncture is a good example, there's always things that could happen as a result of doing the treatment. So if we did nothing at all, then you wouldn't incur those risks. So there's no chance you'd have those risks. So let's say when you stick a needle in someone, you could have bleeding, you could have a bruise. there. And then you could have other things go on depending on where the points are placed in your body. And so those are considered known risks. Like, they're not necessarily because the treatment was done wrong or done, there was no malpractice involved. It's just because you're sticking a needle in, there could be a risk of bleeding or bruising. So technically, when a doctor gives you an injection, they should be informing you of the possibility that you could have a bruise on your skin. Like, they need to inform you every time you are having a procedure of the risks, right? And beneficence is kind of the idea, one of the aspects of beneficence is weighing up this risk and reward. So if we don't give you this treatment, which could incur these risks, nothing will happen in terms of there's no possibility of the benefit of the treatment because you didn't have it, but also none of these risks could occur to you. But if you do have the treatment, there's the possibility of some kind of reward, let's say some kind of benefit of the treatment, but there's also these risks. So does that outweigh those things? And is, out of all of the things that we could do for you, is this the most beneficial thing, right? Is this the thing that's going to bring you the most benefit? And you could even go a little bit wider to kind of think, okay, in an individual circumstance, it should be the thing that's going to bring them the most benefit with the least risk, in those particular given circumstances. And that could change from time to time. Like, what might give you the most benefit with the least risk now might be different in 6 months' time, because the prevalence of a disease, like the amount of disease that's in the society, might change. And so the treatment that you require for that, or maybe preventative treatment that could have a risk involved in it or something like that. These are all things where the doctor or the practitioner or whoever the healthcare worker is should be having that in mind, right? The patient's best interest at heart. All procedures and treatments must be recommended with the intention to do the most good for the patient. Basically, the recommendation that practitioners have to their patients of what's the best treatment is only as good as the knowledge that practitioner has. That's one of the reasons why I'm so committed to ongoing learning, and I consistently and consciously am continuing to study and study and study. And in Chinese medicine practitioners' terms, we kind of tend to study more the past, because it's the more I can know about that, the better a practitioner I can get. It's not about like, what's the latest and greatest new herbal concoction and what the formula that's used. It's really understanding, how, what don't I know about all this history and about all this stuff that I, haven't learned yet, which is, there's so much to learn. Like, it takes you a lifetime to kind of learn all of that, right? Even can't learn all of it in one person in a lifetime. But anyway, what I'm getting at is, let's say you had cancer or something like that, and your doctor was like, okay, chemotherapy is the best option. And then in 6 months' time, that might not be the best option, because new options have come out. Like, radiotherapy might be the best option, or a combination of these things, or surgery first and then chemotherapy, or these, they can change so rapidly, which is hence why in medicine there's so many different specialties and different areas, because for a doctor to be, knowing all of all the research on everything is not going to happen. So they kind of stick in one area, and then, that's how you'll get the best beneficence. So that's why it is good to see a specialist if you had, a particular problem, because they are going to have the latest knowledge within that thing that your GP or your general practitioner wouldn't necessarily be exposed to. Yeah, beneficence is really about your practitioner's level of commitment to ongoing learning, to be honest, and also their ability to probably a little bit of the second one, where we're talking about justice, doing the right thing and the fair thing, right? So if a doctor has a competing interest in a pharmaceutical company, like they own the pharmaceutical company, and there's 3 different companies making the same product, and they have a vested interest, it might be hard for them to have an objective view of things if they have that vested interest in something, a financial interest in something. So I'm not saying doctors can't have financial interest in things, but it just makes it more difficult, and maybe that practitioner has to work even harder to kind of have a more open view. So these things kind of are separate ideas, but they kind of link in together. So you can see where that idea of like justice and beneficence can kind of have that overlap in it. And the last one is non-malfeasance. So what does non-malfeasance mean? It sounds like a weird legal word. Well, it is a legal word. And what it means is to first do no harm. So this idea that Hippocrates first said and made the Hippocratic oath that doctors take, in most countries they kind of adhere to this, which is to first do no harm. And that kind of comes into the idea where I was saying in beneficence, like by having a treatment, there's always some kind of harm that will happen as a result, like a possible harm, not necessarily a definite harm, but something that's going to happen because you introduced a treatment into your body. Now, you may have even more harm if you do nothing at all, which is in many cases can happen, right? So that's simply why we do treatment, or the patient might endure a huge amount of discomfort. Like let's say you take a painkiller for a headache. There's a potential harm that can happen to your body. Like you could have an unknown reaction if you've never taken that drug before, even if it's something as simple as paracetamol. You could have a potential contaminant within that product, which is like, because the company didn't make it properly. And if you never took it, you'd never have that reaction. But you could also have like an overdose of, like, let's say paracetamol is not a good example, but something where a person gets addicted to taking this medication. So yeah, it could reduce their pain, but then maybe 3 months later, they could have a serious addiction to painkillers that they never had before they had to take it for that condition. So there's a lot on a doctor's mind. There's a lot on a healthcare practitioner's mind, right? When they're recommending the treatments to you and they're thinking about what's the best thing to do. And medicine in general should always be thinking about this, no matter what kind of style of medicine you practice, whether you consider yourself alternative medicine or Western medicine or any kind of healthcare. You should always be thinking about autonomy, making sure the patients have autonomy, making sure the patients have justice, that the treatments have beneficience, so that it's beneficial to the patient. There's the ultimate, it's the most beneficial option of treatment for them. And number 4, non-malfeasance. So it's not, it's got the principle of first cause, no harm. Non-malfeasance can also have this dual implication, not just for the individual patient, but for society as a whole. So something could be beneficial to that individual patient, but for society as a whole, it could be quite harmful. And vice versa. There's often these situations where there's a conundrum there, and then it comes back to that beneficence. What's the most beneficial thing to give to this patient given these circumstances? So non-malfeasance is a principle intended to be the end goal for all practitioners' decisions, and that means that medical providers must consider whether other people or society could be harmed by a decision made, even if it's of benefit to the individual patient. So it's important that you as a practitioner, if you are a practitioner watching this, a student, let's say, watching this, you understand these principles, you'd learn them in school and things like that. But hopefully this video helps you understand how they might play out in a clinical setting. But also as a patient, that's the main people I'm making this video for, that you understand these are your rights, and that if at any time you're seeing a practitioner, no matter what kind of medicine they're practicing, they have to respect these things. So these are things where you could say, to the practitioner, no, I don't want to have this treatment because it's that's number 1. That autonomy trumps all of that. They can't force you or coerce you into having a treatment that you don't want to have. So all doctors have to respect your autonomy. And I see this a lot of times with patients. They feel pressured in some way to have this particular treatment. And sometimes doctors are pressuring people because they believe it's for the beneficience, right? So I'm not saying it's not without a good intention, but at the end of the day, you are the patient. If you're the patient, it's your decision. You have the right to that. Now, I did make another video on this channel called Informed Consent to understand that autonomy and the informed consent a little bit in more detail. And so I hope this video has been useful and helpful to you. And if it has, leave a comment below, leave a like, share the video, share the channel. And thank you so much for watching. I really look forward to seeing you again on the next video soon.